I want to begin this session by introducing myself. I'm John Monahan. I'm the interim dean of the School of Nursing and Health Studies at Georgetown University. I'm also the senior advisor to Georgetown University's president for global health issues. And we are honored to welcome our audience online today, as well as we're really excited about the opportunity to host this terrific panel. Let me also thank in advance my colleagues at Georgetown, including Sheila McMullen, who is the director of our Global Health Initiative, and Julia Murillo, who is in our Office of the Vice President for Global Engagement, for all their efforts working with our colleagues at UNAIDS who helped put this together. Before I turn this over to my colleague in many capacities, Dr. Matt Cavanaugh, who is a professor here at Georgetown, but is on leave to work with UNAIDS right now. And we've also worked together over the years, including a couple other people on this panel, Shushu in particular here. It's really great to have you all here. I just thought I might say a couple of words about why this is so important to me and to Georgetown, and why we're so happy to be a host for this. First is, I think it's difficult for any of us to overstate what the last 2+ years have been with COVID. It has been this powerful, momentous global event, really almost of unprecedented proportions, because even when the world has had pandemics before of this scale, we never had the kind of communications that we do today to imagine how things are happening around the world simultaneously. Among the many things that we've learned at least as much as we can as a global community, is the interrelationship between health and so many other things: our economy, climate change, migration. The pandemic has laid bare what everybody on this panel would know as simple truth before the pandemic, that health is connected to everything. And it's connected to our geopolitics. It's connected to the way we organize our societies more or less well to deal with kinds of the crises that we're looking at. But the other thing that we've missed is that we've had other huge issues that the global community's worked on. The HIV response over the last 40 years is certainly one of them. What have the costs been of our focus on COVID? What has the cost been on the progress we've made? I think it's very worrisome. I think we've made, the success story in the global health community about the work around HIV is really at risk now. And so how do we do at least two things at once? How do we make progress as we must on COVID without losing ground, especially at this critical moment in dealing with the HIV pandemic? And if that isn't complicated enough, I think we're reminded now that there's a lot more going on in the world in which the global health, that's sort of the global health world. How do we sort among ourselves between the pandemic and HIV? But, we're living now in a world where there's a kinetic war in Europe. The spillover of that event, whether it's nutrition or food security, whether it's potentially cyber war in a way that we've never seen before. We just have to think, what does that mean for global supply chains? What does that mean for stability? What does it mean for all the other pieces that we're trying to accomplish, whether it's COVID, HIV, or malaria, or fill in the blanks, other global health priorities? So it's a complicated world. How do we start to think, and as a university, how do we help teach students to live in a world where there are a lot of balls in the air? There have probably always been a lot of balls in the air, but it's very obvious now. So how do we think this through? How do we juggle, but also how do we not lose sense of where the priorities are? So anyway, it's for this reason we're really honored to have such a distinguished panel. And I'm going to turn it over to my colleague Matt and thank him for convening everybody here. And again, welcome from Georgetown University, and look forward to this conversation. So, Matt.
John, thank you so much. And thank you to everybody at Georgetown and from all of the UN agencies that have helped put together today's event. And thanks to those of you that are joining. So as I open, similar to John, I want to just remind us of where we are. Right now, we're in this moment of multiple crises. We're in the moment of a pandemic crisis era. COVID-19 pandemic is definitely not over. The HIV pandemic is also far off track from its goals. And so while for some HIV has become rare, death has become rare, infection is a low risk, for too many communities, this is not the case. UNAIDS estimates that approximately 7.7 million people will die in the coming years of HIV if we don't get better ahead of that pandemic as well. COVID-19 has both done harm and exposed some real weaknesses. The official number is 6 million people dead from COVID-19. That is in and of itself a level that outstrips all the people killed in war, conflict, and terrorism combined from the last 20 years. But it's also revealed deep inabilities to address the inequalities that are driving pandemics, that are making us less safe. COVID leaves us with fewer health workers and massively depleted budgets. It also reveals the challenges of building collaboration across countries and securing equity. Omicron and Delta emerged in context of low vaccination. And yet this week, we see an analysis out that shows on the level of excess mortality that low and middle income countries were not less impacted. We just counted deaths less. And while I said 6 million, the actual toll is probably closer to 15 million people. India alone is probably closer to 4 million people who have died from COVID-19. And this is the direct result of vaccine inequality, of inequality of access to treatment. Today, even as the US struggles with 3/4 people vaccinated, in Sierra Leone, just 1/4 are, and in Haiti, just 1.5% are. Of course, we're also dealing with, as John mentioned, the crisis of conflict and war in Europe, in Ethiopia, in Myanmar, and beyond. More than 250,000 Ukrainians are living with HIV, and lack of access to antiretroviral therapy and prevention services would mean a wave of deaths and risk resurgence of pandemic HIV in Ukraine. Ukraine is a success story in many ways too, because Ukraine shows the remarkable community-led networks of people that are vital for maintaining access to HIV services. And people are still getting services today because of those community-based services. So they tells us something about what it takes to respond in a world of multiple crises. And of course, we face global economic crisis. Amidst all of these, all this time, high-income countries, wealthy countries have poured previously unimaginable levels of financing into health, into education, into recovery. But in the global South and low and middle-income countries, they've entered the crisis without the capacity to follow suit, and they exit the crisis even worse so. Countries, especially in Africa, but some in Asia, the Caribbean, and beyond, face explosive debt already and simply do not have the resources to secure a just recovery. And so part of what we'll be talking about today is, in an era of rising food prices, of food shortages that are ringing alarm bells, what do we and what can we do? If it leads to cuts in health and systems linked to it, we will be in a less pandemic prepared community globally rather than a better prepared community. And then ultimately, as we frame this conversation, we face a governance crisis. We have long been in a multipolar world, but as political scientists are telling us today, we are increasingly in a fractured world order with rising nationalism and shrinking actors who have the legitimacy and the power to command cooperative action. And so today we are gathering on the sidelines of the IMF and World Bank meetings, and we face this danger, but we also face the opportunities that it creates. Alongside the crisis, we've seen evidence of remarkably strong and resilient communities and networks. We've seen the ways in which national governments facing a legitimacy crisis, even as many local leaders, especially some in urban areas, have been responding in ways that change the game politically and for health of people. And we see critical conversations happening right now about the new sources of funding that can help bridge this gap, opportunities for international solidarity and pathways to a more healthy and secure world. And so we are really happy, both at wearing my Georgetown University hat and my UNAIDS hat, really thrilled to convene this conversation with the UN, with UNCTAD, with the World Bank, as well as with the Global Fund to fight AIDS, TB, and malaria, and civil society in the person of Oxfam here, who have all come together for this really exciting and I hope really dynamic conversation. We're joined by a number of brilliant people. Jaime Etezena is director of the Equitable Financing Department at UNAIDS. Nadia Dar is the head of the Washington, D.C. office of Oxfam International. John Monahan, thank you very much for being here, the interim dean of the School of Nursing and Health Sciences. Danielle Monivar is the senior advisor with the United Nations Conference on Trade and Development, UNCTAD, and we're really thrilled to have him here. Shushu Tekel-Haimanot is the senior advisor on political advocacy and partnerships and resource mobilization at the Global Fund. And we're also really thrilled to have with us colleague David Evans from the Health Financing Group and Solutions Group at the World Bank. And so these are our speakers. We're going to go ahead and dive right into conversation. And I'm going to start with Danielle. So Danielle, if you can come in and talk to us a little bit about kind of where are we at right now? You're a member of the UN Secretary General's Global Crisis Working Group. Tell us a bit about kind of what is the latest on the Ukraine crisis implications on top of the COVID shock when it comes to HIV investments, health investments, and beyond. Over to you. Thanks so much.
Thanks. I would like to thank Georgetown University and UNAIDS for the invitation to participate in this event. And I would like to put the usual disclaimer that my views do not represent those of my organization, UNCTAD. I think to answer your question, I think when I was thinking of this intervention, I was looking at the title of the session, and it was path. Right, and I think I had a problem with that word, because path implies that there is a road to get from point A to B, and unfortunately, I think the way we have to think about this and discuss about this, if we actually want to get somewhere, is there is no path. What we have in front of us, it's a man-made abyss between where we are and achieving the Sustainable Development Goals. We already knew back in 2015 that it was a very tall order to achieve them, given the very large financing gap that it existed. Just in the case of health, the 2017 analysis of the WHO showed that, for example, in the case of low-income countries, this needed to increase their expenditure, health expenditure, to around 9% of GDP when they were spending less than 2% on average. So it was very clear that we needed to make a big effort. And what has been happening since is not only we're not moving closer, we're moving further away. And the reason we're moving farther away is that if you start looking at time and what has been happening over the last decade, in 2017, you had the most catastrophic hurricane season in history, which was one of the first times where we're already starting to see the massive impact that climate can have on our global community. In 2020, you have the pandemic that UNDP has classified as the most significant development setback in history. And then in 2022, you have a geopolitical crisis that is sending shockwaves across the world. The analysis of the Global Crisis Response Group showed that there are at least 107 countries that are classified highly vulnerable to exposure to food vulnerability, energy vulnerability, or financial vulnerabilities. 1.7 billion people live in these countries. And what we're seeing, this is data up to today, is that, for example, the food prices, if you look at the Goldman Sachs food price index, has gone up by 15% since the beginning of the conflict. The price of wheat has gone up by nearly 30%, corn 20%. According to FAO, those price developments are sending upwards of 20 million people into hunger in less than 1 month. If this continues, that number is going to continue increasing. And if you look at, for example, what's happening in the financing side, the borrowing costs of developing countries have increased by over 10% if we look at what is happening with bond prices. And that is upwards of $20 to $30 billion in additional interest payments that could be diverted to vaccines, that could be diverted to hospitals, that could be diverted to schools, and that instead are going to be paid to creditors of developing countries. And the key problem that I think we need to discuss is the fact that we have these relentless waves of crisis, one after the other. And instead of coming up with solutions to protect the most vulnerable among us, we're constantly asking, as you pointed out yourself, Matthew, not even countries, communities, the most vulnerable communities, to take care of the people that are being affected by this crisis. And we cannot continue like this. And the reason why we cannot continue like this is because the capacity of countries to borrow themselves out of crisis has been exhausted. They can no longer do this. If you look at the comparison between 2019 and now, 108 countries, their debts have grown as a result of the COVID COVID shock. In at least 106 countries in this year, 2022, as we're dealing with this crisis, countries are expected to either increase their taxes or lower their expenditure in order to ensure that sustainability. And that is throwing gas into the fire of already raging social tensions. So I think if we look at this context and we look at, and I'm going to finish here because I don't want to take more time. I think that there is a cartoonist in Latin America called Kino. He's from Argentina, and there's this very funny vignette where he highlighted that in our lives, the urgent things don't leave time for the important. And one of the most important things is health, right? We have seen that countries across the world, despite of all of the financial difficulties, have made enormous effort to increase their health expenditure to tackle COVID. The biggest concern that we should have right now is that process is going to go into reverse. Why? Because the biggest pressure right now is not delivering vaccines, is not ensuring health treatments. It is basically putting food, bread on people's houses. And the issue is that, for example, if you look at what's going to happen with ODA, ODA reached $190 billion last year. But what's going to happen this year is that a lot of that money, a substantial share of that money, is probably going to be end up spending attending refugees in donor countries. So even if that number doesn't budge, what's going to happen is that the redistribution is going to hit substantially its allocation on a geographical basis and also on the lines of expenditure. For example, I would be extremely concerned about budgets for AIDS because most of the financing for retroviral therapies in low-income countries comes from donations. And if those budgets get pressured because of what's happening, then we're looking at a humanitarian disaster down the road. And there is a lot of other issues that I can say on the impacts on that, but I'll just say it at this. Thank you. Check.
Thanks, Daniel. And thanks especially for brevity and moving us along, but with some really provocative points here. And this point about, on the HIV side, we are deeply worried about both of these things, right? Both the AIDS side, which could result in some severe crisis, but also the domestic side, right? The majority of funding in middle-income countries does come from governments themselves. And so as they face economic shock and debt crisis, this is going to have, potentially really shattering impacts depending on how it plays out. So thank you for that and look forward to further conversations. Let me turn now to David Evans at the World Bank. David, thanks so much for being here with us, especially as the IMF and World Bank spring meetings are happening, an incredibly busy time. And so appreciate you being here. So let me ask you, just kicking this off, the World Bank is updating the public health investment prospects for the coming years. We're seeing the impacts of the multiple crises that have been described. Can you give us a snapshot of where you think things stand according to your reports, especially as it relates to countries on the African continent?
Thanks a lot, Matt. It's a pleasure to be here. We have been doing some work to try and estimate the prospects of low and lower middle income countries to spend more on health over the next few years. We certainly believe they need to, most of them, for many of the reasons that Matt mentioned, that many of these countries still haven't rolled out vaccines. They haven't got the pandemic under control, and to have inclusive and sustainable growth after the COVID crisis requires getting it under control now. They need to build stronger pandemic preparedness and response systems in case of mutations of the virus or in case of new viruses. And they need to get the backlog of essential health services, including for HIV/AIDS, that were put on hold during the pandemic under control. So that requires more money. Will they be able to do it? And there were always gulfs between countries in their capacity to spend. But these gulfs have got bigger during the current crisis. To illustrate from Africa, we estimate that 24 countries are likely to see government spending per capita in general, not on health yet, grow over the next 4 to 5 years. These countries are going to do quite nicely. On the other hand, 19 countries in Africa will see government spending per capita contract over the next 5 years, to the extent that it's going to be always lower than it was pre-COVID until 2026. These countries are in trouble. And in the middle, there's 8 countries we're calling the stagnation countries in Africa, where government spending per capita will be a little bit above 2019, but it's going nowhere. What's the implications of this for health spending? Now, obviously, if they give the same priority to health in budgets, you're going to see 24 countries where health spending per capita is growing, 19 countries where it's falling over the next few years, and 8 where it's not going anywhere. This is a problem. And yet, we know that if they increase the share going to health, to some extent, this will get over some of the problem. But how likely is that to happen? The contraction countries, if I take the lower middle income countries amongst the contraction countries, if they keep the share the same, their health expenditure per capita is likely to fall from $68 per capita in 2019 to $55 per capita in 2026. That's a substantial fall. Had they kept on the growth path before COVID, it would have been $103 per capita in 2026. So it's basically half what it would be. To increase, get back on the growth path would require them to increase the share going to health from about 8.4% to 11%. Doesn't sound very big. It's historically not happened in a short time. For the low-income countries amongst the contraction group, it's even worse. They'd have to increase the share from 9% to 20%. That's not likely to happen. And this is optimistic because, as we've seen from the previous speakers, we've also got the Ukraine crisis now, increasing inflation, increasing food prices. The IMF released updated macroeconomic forecasts a few days ago, and basically the projections that we're using are optimistic now. But they're also more complex because we're seeing the countries that are net exporters of oil and commodities or net exporters of food, they're going to do a little bit better. But the ones, most of the countries are net importers, and they're going to do worse. We've also done a survey of African countries of what their budgets have been allocated over the last 2 years, because health accounts data don't become available for 2 to 3 years after the event. So we've been looking at countries. We've got results from 31 countries, and we found that 10 of the contraction countries have actually reduced the share of the budget going to health. So not only is the budget, is the health expenditure, total expenditure per capita going down, but the share going to health is going down. This is a big problem. So what are the implications? It's not all hopeless, but the heterogeneity is the key word here. There's no one size fits all anymore. The 24 countries that are growing well, it is time to say, you can spend more on health. You can spend more on HIV. You can spend more on primary health care. For the other countries, half of them, it's very, very difficult. And just arguing for more for health or more for HIV is not going to work. It's got to be a panoply, a whole mix of interventions. Many of them health people don't feel comfortable with. So fiscal policy, trying to improve the share of government revenues in GDP, which is complicated. It's trying to make better use of the money that's available. It's trying to get the financial institutions and the banks the central banks and the Ministry of Finance to accept that higher inflation at the moment doesn't mean they should cut government spending. So there's a whole bunch of things that need to be done now to combine to get where we want to do in these countries that are at risk of contraction now. So sorry I've been a bit longer, but heterogeneity is the key word here. There's no one size fits all anymore.
No, thanks so much. And I think this is just a really important kind of depth of conversation as we move from where we are today to where we need to be. And I like the 2026 goal, right? We've got a number of 2025 goals at UNAIDS. As we think about this kind of period, we do have to take very seriously the actual context of what's going to move in a very granular way and figure out what kinds of supports, what kinds of solidarity, what kinds of solutions can actually be engineered that will make us move here. And so for that, I'm going to move over with thanks, David, to Nadia Dar from Oxfam International. Nadia, thanks to you for being here. And I know, again, busy times here in DC for the World Bank and IMF meetings. Nadia, we're in this moment of these multiple shocks that are leaving millions behind, as you know well, and as you've heard from everybody so far, whether that's from vaccination or from kind of economic crisis. In your view, what are your thoughts on kind of the actionable solutions in this unprecedented crisis? How can we actually ensure that the investments for HIV, for health, for pandemics writ large, how do we make sure that those don't end up being left behind in this context that I think what's been cast so far is quite bleak? So with apologies for turning to you for some solutions first, you get the first word on positive solutions. Go ahead.
It is bleak, and I promised to get to the solutions that we would put forward, but I do want to just add a little bit to the context, because it's also a matter of the inequality that's deepened through the past few years, especially with the pandemic. And our research has found that the combined impact of COVID-19 with the growing inequality and the food price hikes exacerbated by this current war in Ukraine, we estimate that over 263 million more people could be living in extreme poverty this year. So that's living below $1.90, and that's not even talking about the billions living on less than $5.50 a day. And as previous speakers have also laid out, developing countries are clearly being pushed to the brink right now. They've been hit hard by the cost of responding to this pandemic, its associated recession, and this has been notably driven in part, of course, by this extreme vaccine inequality. And I want to touch on that for a moment, because we see 74% of people in high-income countries fully vaccinated now, but only 11% still vaccinated in low-income countries. And this is, we need to be honest, due in large part to the greed of pharmaceutical companies who are protecting their monopolies at the expense of the global public good, and really the hubris of rich countries who have failed to rein in these companies. And at the same time, we're seeing debt servicing being a painful reality, which, as Danielle laid out, is stripping developing countries of their abilities to provide needed services. And in 2021, debt represented, for example, 171% of all spending on healthcare, education, and social protection combined for low-income countries. So these are intense budget pressures. We're seeing the impact through the pandemic. 2/3 of low and lower middle income countries have cut their education budgets, according to the World Bank, since the onset of the pandemic. It's a dire situation, and it seems to be getting worse. And the World Bank, in its double shock report, has rightly warned, of course, that health financing is under threat. However, returning even to pre-pandemic levels of health financing is unlikely to adequately prepare us to face the future health threats and ensure universal health care, as I think we can safely say. Because before the pandemic, what we saw is that only 1 in 6 countries was actually even investing enough in healthcare. And that meant massive healthcare worker shortages, lack of access to essential medicines, and high out-of-pocket costs for accessing healthcare, which has deepened inequality and exclusion further. So even before the pandemic, the COVID-19 pandemic, there was a shortage of 17.4 million healthcare workers worldwide. mostly in low and lower middle income countries. So that's not what we're trying to get back to. We need to go even beyond that, of course. And it seems like we're still not learning our lessons fast enough. If we look to previous and even current crises, we're still just not learning these. With the Ebola crisis, we saw the importance of sustainable investments in building and scaling resilient health systems. In West Africa, we saw more people dying because of the disruptions of day-to-day healthcare during that Ebola crisis in 2014, 2016, than who died from the actual disease. And now we're seeing the same thing happen with COVID-19, right? We're seeing in Kenya, for example, maternal health resources and workers being redeployed to tackle the virus, which is only having a negative impact on maternal health. We're also failing to learn the lessons from the HIV/AIDS crisis, which is on the agenda today and which we're talking about. But that showed us the risk of highly priced medicines, right? We saw the fundamental importance of equitable access to medicines for all who need them. We saw how even the smallest fees for treatment shut out poor people, especially women. And more broadly with healthcare, we've seen every year user fees prevent 1 billion people from accessing healthcare. With countries with higher levels of out-of-pocket spending on health having a higher rate of premature deaths. So we need to be learning these lessons, and we need to have a better response for the current crisis and make those longer-term investments. But these countries, developing countries' coffers appear largely empty. And unfortunately, what we're seeing is that many of them are being forced down a path of austerity, guided in large part by the IMF. Our recent research that came out just this week found that the IMF is requiring austerity in 87% of the loan programs it negotiated in the past year as a condition of financing. We're seeing that already play out across Africa. So what can we do? You asked me to get to solutions. I'm getting there. So as a first order of business, we need universal access to the COVID-19 vaccine and treatments. We need a full waiver of intellectual property rules on COVID-related technologies. We need to ensure the mandatory pooling of all COVID-19 related knowledge, data, technologies, so that any country can produce or buy sufficient and affordable doses of vaccines and treatments. And just to throw it out there, the compromise that has been proposed by the EU on intellectual property waiver is not at all sufficient. It adds even more restrictions on developing countries' ability to produce or import vaccines. So we strongly think that this text should be rejected and that the EU and US get back to the negotiating table. But secondly, this pandemic needs to be a turning point for investment in health. We need to be able to address the current crises, of which there are many, but we also need to be prepared for future crises. But I also want to say that it's not just about pandemic preparedness and these shocks to our system. It's also that we can secure the fundamental right to health for everyone. It's a core economic right that we're all deserving of. So we need to see unequivocal support for quality public health care for all that's free at the point of use and built on a strong foundation of paid and fully protected healthcare workers with universal primary health care. And it should not come at the expense of other essential services. So of course we need that financing. So in terms of the financing, there are many solutions. Many people have already alluded to them, and I just want to lay them out as I see them. We need to see an increase in bilateral and multilateral aid and concessional financing. We can't keep shifting and redirecting current aid, as a previous speaker mentioned. With the war in Ukraine, I think there's a high risk of that. We need to see an increase in aid. Rich countries need to adhere to what they've committed to previously, which is 0.7%. So that is what we need to see, and it's urgent. Secondly, we need to see a resolution to this massive debt crisis today and for future debt crises. The G20's DSSI kicked the can down the road. The common framework is not working. We need to see debt cancellation from bilateral, multilateral, and private creditors, and it's urgent. We also need to see a global mechanism for debt workouts for the future as well. Thirdly, we have these special drawing rights, which many people have been talking about, right? The $650 billion worth of SDRs that the IMF allocated last August. This has been an essential source of breathing room for developing countries. We've seen them transfer those SDRs to their budgets. and use them for public spending. And now we also need to see rich countries reallocate their SDRs that they don't need to those countries that need them. And to be honest, given the scale of the converging crises that we're in now, we need to at least have a new SDR issuance on the table and think about how SDRs can be used in times of crises in the future. But ultimately, and I'll end here, one of the most important things that we need to see is a ramp up on taxation of the rich, on corporations, and on wealth. That wealth that has skyrocketed through this pandemic and is a source of untapped revenues. We need emergency solidarity taxes, and we need permanent taxation to fundamentally source revenues for these kinds of investments. These proposals are doable. It's not that we don't have the resources, it's that we don't have the global solidarity or the political will from our leaders, but we need to get there, we can get there, and it is urgent that we get there. Thank you.
Nadia, thanks so much for that really clear and powerful call for action. And I think as we circle back, hopefully we can leave a few minutes for conversation here. And so just reminding our colleagues on doing the 5-minute goal. So turning now to Shushu Tekel-Heimanot. Shushu, thanks so much for being here and for being across the table from me and thus the background noise. Sorry about that. I'll mute in just a moment. We're going to go ahead and ask you about kind of the financing for AIDS, TB, and malaria, right? This is the year of the Global Fund replenishment. This is one of the most important things that's going to happen this year on the core conversation that we've been having, right? Are we going to have the resources to be able to really invest in AIDS, TB, and malaria, but also beyond, right? And the vision that the Global Fund has really laid out thinks about how we use these funding mechanisms better and more effectively in the middle of a pandemic. So what are the priorities that the Global Fund is kind of bringing forward for action on this replenishment? And how do you think that the role of the Global Fund is going to be able to respond to what you've heard so far? So over to you. Thanks so much for being here.
Thank you, colleagues, UNAIDS and Georgetown for inviting the Global Fund, and I'm quite delighted to be here. But it's always going last after such great speakers is an issue, but I'll try to do my best. So I recently had and I'll start off with a story because I recently had a meeting with the Minister of Finance, and where we were talking about, look, you need to increase money, you need to ensure your colleagues in the Ministry of Health are staffed well, ensure that resources are used well. And so one of the things that was brought up in that discussion is that, okay, we have today Global Fund coming to us, tomorrow Gavi coming to us, the next day UNAIDS or other institutions. So one of the things that I took away, and it was a group of ministers of finance and health, is that I think the time has come when we are talking about financing, whether it's for pandemic preparedness, whether it's for HIV, TB, malaria, and Ebola, that we must have a broader and more holistic discourse around health financing at a systems level. And I think, and what was also really important in that conversation was that he was saying that, well, you as a technical and donor community, you should allow us and support us in such a way that there is flexibility in the financing to address some of the issues that come up, like things that are unexpected, like the pandemic. And then also, there's a lot of resources. I personally, in terms of money, for example, from the Global Fund that's gone in to support health systems, we've got almost $1 billion in 3-year period that we give to health system strengthening. And I think there is room now, and I think this is a great opportunity. How do we coordinate all of our resources together to really make a push for the systems changes that we need to respond to PPR and others, right? And then the other thing is, how can we get everybody together to think creatively? How are we going to be financing, the existing gaps? We know that ODA has some problems. We know domestic financing for countries has some problems. I think the World Bank colleagues, UNCTAD and others, Oxfam, have clearly eloquently stated that there is immense challenges in fiscal space. one of the things that we think at the Global Fund is really trying to engage in how we can become a better partner to ministries of finance and ministries of health. You know, how can we together as partners, not just at the Global Fund, but as partners really become greater partners to be able to address those issues? Because if you talk about even COVID-19 and the pandemic preparedness, it's really about health systems. Those are the kinds of building, you know, that system level, and we need those discussions together, both at the global level, but in particularly at the national level, because that's really where the action is needed. And I believe that, I think with the Global Fund investments in HIV, TB, malaria, we were able to build some of the backbone that you see countries at the moment being able to utilize to respond to COVID-19. It wasn't. It's not perfect, but there were already some systems, and we thank our US government colleagues for really working hard to get additional 3.3 billion in addition to what they give to the Global Fund to be able to support COVID-19. And with that, the Global Fund decisively and at scale was able to really support countries, at least 100 countries, 100 programs in averting some of the major issues that we have seen in developing countries. In addition to that, I think the COVID-19 also brought in some opportunities in really innovating. Different innovations, a multitude of ideas that could be scaled up to regain some of the ground that was lost in TB, malaria, etc. So I think those things, we can go to scale now with some of those innovations and lessons learned that we have done. In addition to that, this is why the Global Fund has been a great supporter of the African Union ALM initiative, which is a flagship initiative on health financing, really helping countries to be able to undertake the health financing reforms that are needed, including working with the World Bank and many other partners that are at the table. And now on the replenishment, I think most people have said this, it's going to be a very challenging time. We call on everybody to support because there is the economic recovery, COVID, Ukraine. Luckily, we've had 5 African presidents who've come out and really supported it, but it's going to be challenging. And so this is why we count on every partner here and everywhere in the world to really come out and support the replenishment of the Global Fund. I thank you.
Shushu, thank you so much, and really appreciate that. And this call to rethink how do we think about health financing is, I think, one that's at the heart of a lot of what's been said here, and really needs 3 more hours. So the next installment of this particular conversation needs to happen and needs to be far longer. And let's do that. So our final speaker, and then I'm going to open up for some questions. Colleagues are welcome to put Q&A into the Q&A box, and we will try to get to as many as we can in this short time period. Is over to you, Jaime Atienza. Sorry, let me pronounce my colleague's name right. The risk of a silent AIDS crisis is really out there, and we've been kind of raising that since the December World AIDS Day report. What do you see as the actions that are needed to change this course and get us back on track? The financing challenges specifically, what is it that you think we could actually bring a positive change to? How do we get there? I guess I leave you with the final task that I tried to hand to Nadia about where do we get there, and how do we actually find some solutions in this harassing and challenging moment? Thanks. Over to you, Jaime.
Thanks, Matt, and thanks, colleagues, for this fantastic session where we've already heard so much about what's going on. And trying to go to the point, Matt, that you were bringing, I think we are talking about a silent AIDS crisis because we have got used to the very contemporary and we could say vanguardist COVID crisis where you had a shock, you had a spike, you had deaths, and you could see almost in real time, but that's not how AIDS works. So if we are sliding back, as some indicators show, we will have 7.7 million deaths by 2030. We can avoid at least half of those with the right investments. We were getting those numbers from our most recent report. We need to bear this in mind. It's a slow onset. We are not going to see like a fire coming, but we need to take much care of this. This is a long-term priority, and it's long-term measures that need to be in place. This morning, I found it very wise how Dr. Kaberuka was initiating our session with the Global Fund, saying springs are normally about the burning issue of the day. So that's what you talk about during the springs, what's happening today. But we also need to talk about what's coming up, and health is one of these things that has a long track and needs kind of long-term attention. So I think this is what it should be about. So to revert the shock that is affecting AIDS as a pandemic, and that is affecting health systems, and the shock that COVID meant for many countries, we are going to need financing measures and action at country level. Luckily, my colleagues have mentioned most of those already. I think I want to just reassure, we like thinking about 3 buckets of financing. The domestic should be the most sustainable, the stronger for the future, the one that will allow countries to really free up and be solidly protecting their people. But of course, with the fiscal crisis, David was mentioning, and Daniel brought to our attention as almost an abyss, a financing abyss. That's the situation now. But we need tax reform, we need tax transparency, we need more health taxation, and we need to do all this to increase resources in the medium term. And of course, there's global taxation reform to be put in place. We need to tie this to health investments and AIDS investment, but domestic revenues are key, and tax reform is critical for that purpose. There's a second bucket, it's the donor bucket. Much has been said, and I can only add the Global Fund replenishment is the key piece of that bucket in this year. That's where everyone will come together. But we need to keep an eye also on ODA that goes to other connectors of health and obviously education. And as UNH, we're pushing our Education Plus, focusing on secondary education to protect young women and girls from AIDS infection as a key issue, need to be there. But we're also looking at increased development cooperation from non-DAC actors. We need to think that we have a very big world and that many actors can bring energy, action, and financing to the table. So that's the second bucket, the donor action. And the third one is the other financing streams that are uncertain, but will turn into real, the debt cancellation that we need and that we will see happening, because there's no getting away from the depth of the crisis we are seeing. So there will need to be action. It's a pity that we haven't seen that action, and it really has not spoken to the needs of countries in the past, but it will come soon. We also want to see this SDR reallocation to be effective, and we want countries to prioritize, among other critical issues, also health. That's a long-term investment, and that's a building block for economic recovery. That is the way in which I think we need to think about health. So that's our third bucket, looking at the other streams of financing and working for those. Of course, to make that money work, we need to work hard also on other costs, the cost of medicines, the cost of vaccine, and there we can look at ARVs and the next generation of ARVs, and we want to work to make sure we get low prices. We want to work for the prices also in middle income countries, because that absorbs a huge amount of money that could go to improve the AIDS response and other pieces of the health system. And we want to talk about COVID vaccination still, because yes, it's not over, and it's part of getting countries back on track and having a healthy capacity to respond to future pandemics. I think let's leave it there, Matt, because I think it's a big conversation. We are bringing some of the solutions, and we want to contribute and do this in this community we are of agencies and with governments and civil society as we need to go forward. This is a key year, and we want to be together in this action.
Thanks so much, Jaime, with deep appreciation for your succinctness and your clarity. Let's go ahead. I'm going to share some of the questions that have come through in the Q&A, and maybe just in the interest of getting to as many as we can, I'm going to ask for slightly, lightning round answers. So if folks can kind of try to keep an answer to a minute and see if we can kind of do a round of at least one to everybody. Daniel, I'm going to start with you. So we've got a call here, that's being put forward by a colleague who's asking about middle income countries. And I think that's an interesting place to start. You describe kind of where we are and where we're moving. How is it that, while health financing conversations need to happen, what are middle income countries? What are their actual options at this point when it comes to both kind of economic growth, but also sustaining health financing in this context? We are, talking, and we will talk more about kind of the low income countries, but the middle income country reality, that is actually where we see the majority of HIV infections in 2021 is in middle income countries. And so we are really worried about this. So talk to us about kind of what are the options for middle income countries at this point, and how do they move forward in this context, which of course is not possible to say in a minute, but I'm giving you a minute anyway. Thank you, Danielle.
Thanks. So one of the key issues is I mentioned that the estimate is that 107 countries are considered highly exposed to this crisis by the UN. One of the fascinating aspects and concerning aspects of this crisis is that actually most of these countries are middle income countries, and as another substantial group of countries there are a small island developing states. What is concerning about this is that there are a couple of elements. Is that actually, for example, in the case of the food crisis, the food crisis that we're going to see this year, it's a very tragic food crisis, because it's not that the food doesn't exist. It's that what's going to happen, and the reason why people are not going to be able to eat, is because of the affordability of food. So where you're going to have the biggest hit in terms of poverty and in terms of hunger is not low-income countries, which of course are highly exposed, but actually in terms of absolute numbers, it's middle-income countries. The concerning part of that is that if we go back to this idea that we're leaving people to fend up by themselves, is countries have exhausted their ability to borrow out of crisis. Middle-income countries receive no substantial support in the context of the COVID crisis. They literally fell through the cracks. And now they are being asked to deal with this crisis once again with depleted policy buffers. If you look, and I'm going to finish on this, it's very interesting. If you look at the fiscal responses of middle-income countries, they were able to increase expenditure, they were able to reduce taxes and increase expenditure by about 5% of GDP in the context of the COVID crisis. But at the same time now, between 2020 and now, they have the ones that have consolidated the most. And they are the ones that are expected to consolidate the most this year. So the prognosis is not good. That is why the call of the Global Crisis Response Group is that we need to think of debt relief as a mechanism to provide support and forget about income thresholds, because focusing on income thresholds means that we're abandoning millions, hundreds of millions of people that need the help of the international community. Check.
Thanks so much. Shushu, I'm going to come back to you quickly. There's a question to you here about kind of thinking about the pieces, and in part building off of Daniel's point here. We've got kind of middle income countries, we've got low income countries, where there is so much money going through international financing mechanisms, through aid, et cetera. How do we think about that in a context of a real push for local production? And you had talked about some of these things as being a partner. What's the role there of aid in local production? And also, how does aid get out of the way of local production and really make that happen? Thanks.
So thank you for that question. I think in terms of local production, what we have seen, at least for COVID-19, is that countries have been innovative enough to be able to do with little money. And you've seen that putting in their own money or private sector investments, coming up with masks, locally masks, etc. And I know that we were working with the African Medical Supplies Platform through the African Union to get all these countries to be able to at least get a market but that was quite difficult because of, economies of scale, quality, etc. And I think what the African Union now is doing is through the African Medical Agency is to really work with countries to be able, at least where there's that opportunity and where there is funding for them to be able to see where are some of the niches in those countries that are able to manufacture. We have also seen how, because of the vaccine hoarding and not being able to see where we've seen South Africa, Senegal, and Rwanda now being able to open up to manufacture vaccines, right? Some of the mRNA. So I think the issue is that for our continent, at least in the African continent, is to understand on local manufacturing. Not all countries are going to be to do that. You do need economies of scale, and you need to also create the markets for them. And so that's one issue that we see. And I think aid, yes. I think for a lot of the countries that we do provide funding, I think a lot of times many countries have become complacent because they feel like HIV, TB, malaria, they've all, the donor community is covering it, right? And oftentimes when you do have all these resources that are coming in and government is not really taking that responsibility and also doesn't allow for innovation because that is being covered by other parties. So, and I think what we're trying to do now, and I think this is the opportunity that COVID has provided, is how can we open up that space? But looking at, the regulations, putting in the necessity, and that's why the African medical agencies and the African medical supplies through Africa CDC are going to become quite important moving forward. Thank you.
Thanks, Shushu. Moving then to Nadia on something linked here. There's some questions coming in around kind of, we have really struggled to get a clear answer from the WTO when it comes to a waiver. And then we've also struggled to get technology transfer. So what do you see as the prospects of kind of how do we get to a more equitable system in this context, where we don't end up, where we can end COVID-19 and we can also not end up in a next pandemic in exactly the same dynamic. How do we move this technology transfer piece especially? So over to you.
Thanks. And I will say that I remain optimistic despite how difficult the situation is. We've come a long way since 2020 when Oxfam and in partnership with UNAIDS and many others have the People's Vaccine Initiative. I encourage people to read more about it. I can put the link in the chat. But at the beginning, it was not even on the table when the pandemic hit, and it has now become, very much part of the discussion. We saw President Biden come on board with the TRIPS waiver. We saw South Africa and India really make a huge push towards this. We saw President Macron get on board. Like so many different leaders did come on board, but yet we still face these difficulties. And I think part of this is needing more global solidarity. I know I used that word already, but I really believe this is a fundamental piece of it. And getting all actors, multilateral actors like the World Bank, for example, is financing a lot of vaccine programming in countries, explicitly saying how much further their vaccine financing would go if prices of vaccines were to come down and there was more manufacturing of vaccines, would be a very powerful statement for the World Bank to make, for them to come on board, for the IMF to come on board, showing the economic impacts, which they're already doing very well, and linking that to the need for this waiver. And on technology, we have this, we have the tools, we have the we have the technology transfer pools, but really without the intellectual property waiver, we're not going to be able to have maximum impact of that. So just, finally, I think it is political will. I think we all have a role to play. I think citizens around the world have a role to play to hold their governments to account and to push them to move forward on this.
Thanks, Nadia. David, let me come to you with a question, which is really on kind of where you've heard several proposals here for how do we get out of this challenge that you've put forward, right? There's the conversation around debt cancellation. There's a conversation around using SDRs. There's a conversation around a few things. You've told us where you think the trajectory is going in the near term. What are your kind of top hopes about how we actually get ourselves out of that?
In 1 minute.
In just 1 minute, if you could solve the global economic crisis in a
Alright.
minute, we would be deeply appreciative. Thank you.
I mean, I think a lot of what the other speakers have said are hopes for what can work. I would focus very much on those countries that are at risk of contraction. I think that some countries, middle income, some low middle income, are doing quite well. So I would be much more targeted in my approach. I think the debt, it's not just debt delaying and debt forgiveness, but it's also the question of, are countries allowed to take on more debt? And I think there's a growing feeling that some of the limits that the IMF has been placing on countries' and ability to take on debt at the moment are too rigid. Some of the limits on spending when inflation is high are too rigid because this is unusual inflation. So I think some of those international things will bear fruit. Unfortunately, on debt, there's been a much growing increase in the share of debt in developing countries that is by private commercial institutions, and that one's much more difficult to deal with because it's not the traditional sources of debt where we can say, well, we can forgive them. Someone's going to have to deal with that. But I think there is things in the tax reform and tax policies that many of these countries have delayed doing, and the share of government revenues in GDP is very low in many of these countries, and it's not excusable for it to be so low. So this is an opportunity to work much more on these questions as well. So that's 2 minutes.
Thanks, David. Brilliant 2 minutes of that. Thank you. Jaime, over to you on a question here, which is about communities, and we're moving toward wrapping up here. But there's several questions in here about how do we get community-based organizations and community-led organizations at the center of this, and in facing global economic crisis. Often these are the things that go first, right? We lose the funding that has been sustaining these pieces because we think of them as not part of the health system. So what do you see as how we move more of that funding and how we actually get some sustainable financing into community-led services? Over to you.
Well, Matt, I think thanks for the questions and thanks for this great exchange. You know well that is one of the dearest issues and topics for UNAIDS, and we are very carefully looking at the costing, the different mechanisms and the instruments to guarantee that community-led response is one of the elements that are part of health systems, and they are seen that way in a more natural way as we go. So they are funded as the rest of the system is funded, and they are considered the extension of the system that will allow to reach to those that are on the borders. And as we all are talking about inequality as a big trouble and problematic element of the AIDS agenda, of the health agenda, and of the overall development agenda, we need to bring these communities to action, and we need to include them in the different financing mechanisms. And I think it's probably our own job, our modest job as UNAIDS, to provide with the right assessment instruments, resource tracking on how that goes, and effective costing, so that others that can bring in the funding can do that on a regular basis. And we have to bring also the policy energy to change and to introduce that as part of the health systems. Normally, we are moving towards strengthening primary healthcare as a result of this COVID pandemic that has had so huge impacts. We definitely need to make sure that the community-led response and that communities are considered to be part of that primary healthcare. Probably if we were talking about different levels, that would be probably the basement level where you can really reach the places that others will not. And I think it's part of the duties we have for this period, building that up and making sure it strengthens and it reaches out to the people that need it the most. So we fight inequalities by doing so.
And with that note, I will apologize to everyone that we've hit our time limit for this really interesting conversation. this has got to be kind of the beginning of a set of conversations that happen. And actually part of what this is causing me to think is that we should probably think about kind of extending several of these pieces. You know, we heard the pieces from Danielle and from David about really kind of where are we on these the kind of indicators of crisis, and the bottom line is we are at very high levels of indicators, right? We've got to be able to figure out how we solve the problem, Danielle, that you raised, which is that very little has actually been offered to kind of fix the fiscal crisis here going forward. And so how do we row in the same direction? At the same time, thank you to Nadia for raising these questions around how do we actually get not just debt cancellation, not just kind of the use of SDRs, but also the kind of shifts in the system that would enable more affordable medicines and more affordable pieces, which is a piece of how we get out of crisis. And thank you to Shushu and to Jaime for kind of highlighting several of the key pieces when it comes to the aid architecture. You know, if we don't do things that are quite different than the way that we've behaved over the last 2 years, we will end up in a far worse situation than where we are right now. But it does seem like there are some kind of good, if not ideal, at least good ways forward that actually might be able to kind of get to the place that I think, Nadia, you were describing as, a kind of hopeful, a slightly hopeful place of what global solidarity could look like. So let me just say thank you to the Georgetown Global Health Initiative, to the O'Neill Institute for National Global Health Law, to all the colleagues at UNAIDS, and to all of our speakers for being here on what was a short but really robust conversation for something that was only 60 minutes. It does seem like perhaps all of you should be in charge of what comes out of the next few days. So perhaps we'll forward the recording on to the world and hope that some of these pieces come out. But as we really do think about kind of what are the policy responses we see here, perhaps we as UNAIDS can commit to digging in a little bit on a few of these in detail and coming back with some clear ways forward. So thank you all for being here. Thank you to those of you who stayed up late to be here, especially, and thank you to everyone who joined. Over and out until the next piece. Thanks very much. John, over to you for any last words.
Really just want to echo my thanks, Matt, to you and the panel. What a just a stellar review of the complex issues that are before us. So we would welcome being a partner again for if there are any successor conversations you want to convene. So thank you.
Wonderful. Thanks, everyone. We'll share a recording out and also try to put this on social media for folks to see. Thank you all for your rich contributions. Bye-bye.